Today we are going to dissected body of the human. We are going to study the different structures of the neck region. Dissected part of the neck, which are the structures we are going to see today on the cadaver. So neck region, where we are going to see the first one, which is a part, we are going to cut the first in this incision. We are making to dissect the neck region from the mentum to the suprasternal notch, and the skin is reflected on both the side laterally. We are going to reflect. This is the one which is a thin muscle which is covering. This is we call as a platysma. Outermost superficial muscle of the neck which is covering, attaching to the base of the mandible. This we call as a platysma. So immediately after the skin dissection, we are going to see the platysma muscle. Then once we reflect the platysma, we are going to see the muscles of the neck region. In this we are going to have the first one here. We are going to get the anterior belly of digastric muscle, and here we have the posterior belly of digastric muscle. Then we are going to get one big muscle, one which is in the neck. This is known as a sternocledomastoid. This is a sternomastoid or the sternocledomastoid, originating from the sternum, sternal head, and clavicular head originating from the medial end of the clavicle. This sternocledomastoid inserting at the mastoid process of the skull, where it is inserting, and that is one of the muscle which is making the boundary line for the anterior and posterior triangle of the neck region. So going to the deeper to the neck region, in this we are going to get this muscle as a sternohyoid muscle, and this is we have the superior belly of omohyoid. So sternohyoid and superior belly of omohyoid. Below this it is forming the inferior belly of omohyoid. It is in the posterior triangle of the neck. So that when we dissect the neck region, you can see here muscles of the neck, sternohyoid, superior belly of omohyoid, and below this we have the sternothyroid muscle, sternothyroid. So that here you have the hyoid bone, thyroid cartilage, and we have the thyroid gland. This is a thyroid gland, thyroid cartilage, hyoid bone we are going to get in the neck region. And as we have in the neck region 4 sub-triangles of the anterior triangle. The anterior triangle is a area or triangular muscular space in front of the sternocleidomastoid muscle, that we call as the anterior triangle of neck, which is bounded, which is posteriorly by the sternocleidomastoid, anteriorly by the median plane, mentum to the sternocleidomastoid, that is a manubrium sterni, and base of the mandible, line joining the angle of mandible to the mastoid process. This boundary we call as an anterior triangle of the neck region. This anterior triangle is consist of the 4 sub-triangle. One we have, this is a submental triangle, and this is a digastric triangle, which is, then we have the here carotid triangle, and this is a muscular triangle. So muscular triangle, carotid triangle, digastric triangle, and submental triangle. So that submental triangle contains the submental group of lymph nodes, and one major content in the, which is we call as a, that is the digastric triangle, is a submandibular salivary gland. This is a submandibular salivary gland. Carotid triangle, which contains the great vessels of the neck, common carotid, internal carotid, external carotid, vagus nerve, all internal jugular vein, they all form the carotid sheath. This carotid sheath will be the content of the carotid triangle. Then muscular triangle, we have the infrahyoid muscle. This is a hyoid bone. Infrahyoid muscles are the major content of the muscular triangle. Those are sternohyoid, sternothyroid, thyrohyoid and omohyoid. Those all are the contents of the that is a muscular triangle of the neck. So that with this we can come across here the submandibular salivary gland, and we have the thyroid gland. We get the bilobed structure. Below the thyroid cartilage we have the thyroid gland, then thyroid cartilage, and this is a hyoid bone. So this is the anterior belly of digastric, submandibular salivary gland superficial part we are going to get. Here also in this side you can see here which is we call this is a common carotid artery here, and we have the internal jugular vein, and also we are going to have the vagus nerve in this. So these all are the content in the carotid triangle. This is whatever, okay. So this is all of the content you should know in the neck region. And thin muscle, which is we call this is a platysma. So this is a structure, different structure of the neck region, where we can come across the infrahyoid muscle and anterior triangle of neck. Then behind the area of the sternocledomastoid, this area will be we are going to call as a posterior triangle of neck. Area behind the sternocledomastoid, inferiorly above the clavicle, and sternocleidomastoid and trapezius joining point will be the boundary line. So this is a posterior triangle of neck, and this is the anterior triangle of neck with the four subtriangle: submental, digastric, this is a carotid and muscular. So this is all about the dissection of the neck, where different structure you can get it. So here I can show you the carotid, common carotid artery, internal jugular vein, where in the carotid sheath containing the carotid sheath, common carotid, jugular vein, and we are going to get the vagus nerve also. So this is about all about the dissection of the neck region.